Welcome, welcome, welcome. As always, you are in a safe, fun, and fabulous place where we're going to be really deep diving into the iCCaRE Insider, people behind the scene, people behind the progress. I'm your host, Stephen Johnson, and I have my long lost now. We're still trying to go through Ancestry to see exactly where the
Doesn't matter.
connection meet, but I call her my cousin, Dr. Johnson. Welcome to the space. How are
Cousin.
you? Yes, yes.
I am so happy to be here with you, Cousin Stephen.
Yes,
Nice to be
I'm
here.
happy that you're here with me.
Thank you.
Tell us a little about yourself.
So, outside of being Stephen Johnson's cousin, I also have the pleasure of working as a physician in the Northeast Florida community for 30 years, half of which I've spent doing clinical trials, and a significant part of that working in the cancer research space, which brings us to how we got to meet in the world of prostate cancer. So, I work as the Director for Community Clinical Trials Administration at my organization, where I have the pleasure of really connecting curated clinical trials or a select group of clinical trials that I feel would benefit people in the community who are not usually people who would participate in clinical trials. And so I work with physicians and patients, clinical trial teams, scientists across the community and at my institution. And I'm honored to actually do that in the space of prostate cancer because I also serve in the clinical trial space for the iCCaRE program in particular for the grant and get to oversee what we call the Clinical Trials and Translational Science Core. That's a mouthful,
Yes.
but it's tracks. So I'm
Okay.
also, I get to work with the tracks core for iCCaRE.
Speaking of iCCaRE, what brought you to that space with them particularly?
Oh, Palachiodetna is a short answer. So I'm a trained family physician. So 30 years ago, I came to this town, trained at Mayo Clinic, and what I call womb to tomb. So I was not I didn't fashion myself a cancer specialist or even prostate cancer. While I have always been an advocate for underrepresented groups, under-resourced groups, I did that, from womb to tomb. A few years ago, because of my work in the community and clinical trial space, my sister, mentor, friend, Dr. Palachiodetna, who has 3 decades plus of prostate cancer specific experience, came to me and we started talking about ways that I could collaborate. Her passion has always been the community, and I was in the community. And so we talked about how could we use the connections and the processes that I had created to be successful in other trials to really enhance some of the work that she was doing in these $1 million trials for the federal government and iCCaRE in particular. So joined her team and came back to the clinical trial cancer space, and cancer then as intimidating as it first sounded, it became kind of like my bread and butter for the day. And not too much after officially being in this space, I realized as a family doctor, I've really been in the cancer space all of my career. So it became less intimidating because as a physician, I know now things I didn't even know when I started doing medicine, things about screening and prevention and early intervention and genetics. And all the things that I was doing as a primary care doctor was really to prevent cancer, to find things early. So I think I've been a cancer doctor in the closet without knowing it all along, and so it's a very comfortable space. So it really was what I call kismet, the stars aligned for this particular role, but I really see it just kind of like life full circle for me.
Wow. So when you were talking, a keyword stuck out to me is accessibility. You have the opportunity to get that access and share that access, but what does accessible health, good health, great health, those keywords, what does that mean to you both from a professional and personal point of view?
That's a great question. Accessible health is important, but accessibility isn't everything. As a scientist, as a physician scientist, we know that you can have 2 people in the kitchen and one person can be hungry in the same kitchen. So it's important that patients aren't only able to get into where there's accessible care, into the kitchen, but that they trust the food that's being served, that the people who are cooking look clean and the people who are serving them in medicine look trustworthy. So accessibility is not only a physical and a geographic thing for me personally or professionally, but it means having an opportunity to have equitable care that will allow you to get the best outcome that you can get from people that you trust in a system that was created to serve your health and to produce wellness equitably and justly. And so access is important, particularly in states like ours where sometimes it's really limited to like an insurance conversation and a benefit conversation. But there are many people who may have access or may have insurance or have a telephone to make an appointment, and yet they don't go. And that's because it's not or, it's an and thing. If you must, even if you have the benefit, the financial wherewithal, the resources, you must be met with something that is going to be a benefit to you. And so accessibility is when those two things come together and serve the patient and the community well.
So, and again, you're touching so many points. I need to look at my notes, but
Well,
I'm telling you,
promise.
when you talk about accessibility, you brought up a good point. Sometimes accessibility is because of lack thereof or lack of knowing. When it comes to your everyday job and the things that you do, how do you and your team address those hurdles, especially in the Black and brown community where it is so prevalent and systems and data has shown that we have reserved less?
It's exhausting. So the privilege that I have to sit at tables, I use as carefully, cautiously, and proactively as possible. So in my position and career-wise, I've been able to sit at tables where I could say, maybe that's a little too complicated. Maybe we need that translated into different language. Maybe we need hours that match patient times when they're not at work to make appointments. And so there are times where my role has allowed me to impact policy and create some operational changes. But then there are times when I have been able to recognize where there really are no means for certain people, and that means there's no bus station that's close to my institution. There's no, access to a ride share, and that has also meant me advocating to take what we have to the patient. And that has been probably one of the bigger joys of the last decade of my work, is being able to decentralize a lot of what we do. And it starts with education. I mean, it's not just because I think you need blood pressure medicine, I go and, here's blood pressure medication. But it starts with educating patients to be partners and advocates for their own health. Advocating for patients to understand what trust and trustworthiness looks like. Advocating patients to, essentially not cut off their nose to spot the face, to understand that we get it. We understand that there are challenges. We're doing the very best that we can. And while we're only 5% of all the physicians in this country are Black and brown, according to the National Medical Association, and that number is not a great number. We do live in a community where we kind of assume that, there are a lot of people. But in general, there's still a very small number of people who are Black, African American, self-identifying as Black physicians to do this work. So as long as we're all doing it together, as long as we're starting local, as we're making sure that there's accessibility, we're supporting educational initiatives, we are making sure that our patients, whether it's one-on-one in a clinical space, or if it's at a church event, or if it's at a Pride festival, that we are making sure that we are creating partners for health and wellness, and empowering, right? Empowering patients to be part of their health and wellness journey. And when, more needs, more critical situations arise, my dad was diagnosed with a cancer, and, what happens when a person, West Indian like my dad, with a very thick accent, goes to a hospital and they're like, we can't understand what he says. Making sure that I remember that experience, and I recognize that there's a lot of education that needs to be done internally to make sure that the entire team of medicine is more sensitive and more culturally humble when it comes to diversity and it comes to difference in how patients are showing up once they show up. So,
because education is so important, and I said that is one thing that is so valuable. You can't even, I say you can't put a price on education, and it is something that nobody can take from you. And once you have it, honey, you run with it. That's what I said. Run with the education, people. But
yes, and it's a marathon kind of run too, right?
Yes,
so, and that's important. So, there are times where You know, and sometimes there are situations where you just want to win the race, right? And we want to win the race and we get the W and we're out of there. But for this space, when we look at the gaps that we're looking at in medicine, particularly where prostate cancer, where iCCaRE is concerned, we look at changes that are right before us. We look at treatment that's evolving. We look at just all the wonders of modern medicine, and yet we look at Black men who are dying 4 times more, being diagnosed 4 times more. We're looking at a burden of a particular cancer that one group of people really is just carrying a significant amount of that burden, right? So I can educate you that the burden exists. I can educate you on the statistics. But what I also need to do is understand. Like you need to educate me,
exactly.
right?
Work
to
together.
Understand, right? To understand what are the reasons that you're not engaging. What can I do to make this an easier process for you? How do I have a conversation? Who do you want to have the conversation? Because I may be saying that you need to have a screening test done. I may be telling you that if you're getting up 4 times at night to urinate. I may be telling you that if you fear, sexual dysfunction and you're, that's the reason. And I can tell you all that, and that's education, but you need to tell me what would success look like for you? How can I meet you where I can help you to discuss your biggest fear in this space? And that's an education that's really a back and forth. We educate each other. And it's also an education that's a marathon, because that conversation might be different with different people. Different points of your education might change what you need. And it's important that we just meet each other where we are when it comes to the educational journey in medicine.
Exactly. I would say, and this may be a little bit biased, y'all, but I would say, no, we are one of the most diverse and educated and wonderful folks. Yes.
We are, and that's our challenge too. I think that we often broad stroke people. You're Black, you're brown, you're Asian, whatever. And when it comes to Black and brown people, we are different culturally, how we were raised, what's important to us, what we hear, how we hear things. We're different in the what we call genetic admixture, and so understanding that even is extremely important, to recognize that you've got to be like multilingual, right, in your education. It doesn't mean a different dialect, but you've got to understand who you're talking to and all the things that make that person who they are.
And with that information, how's it received from the community? I mean, we just said it right now. Our community is diverse, so you're going to have all walks of life. You're going to have to, just really be a chameleon and transform to make sure that the information you're giving, that its importance is shared and that is well received, and not they just be hearers but doers of the word that you're providing for them. Okay, I'll stop. But when it comes to receiving, how is the community receiving your information?
Differently. I would say on balance, personally, I have spent 30 years in the community. I've raised my children in this community. I've answered yes to many things, to show up at places where they wanted to, hear about blood pressure or prenatal health and other things. So when I enter into space now to talk about cancer or some of the more difficult topics, they trust me, right? Good. And so personally, I have really worked to not only hear, to be doers of the word, but also to earn the trust of communities. And when you earn that trust and when you begin with the end in mind, I think that serves you well. But in general, as we look at, you said the community is diverse, it requires the ability to meet people where they are. And so people will hear you if they understand you. And more than that, I think this is either a quote by someone or an idiom of some sort, but it's often said that people can hear what you say, but they actually want to make sure that they understand that you care about them. And so that's extremely important when you're meeting the community, to make sure that you are part of the community, making sure that they understand that you care about them, not about your science or your interest or what you need. And I often tell everyone, and because we're in a society where it sounds selfish when you say, what's in it for me, but I tell everyone to start there. You must ask, what's in it for me? Because we have to be discerning, right? And I know you probably have a scripture on that, too, right? But we have to be discerning and ask those questions when people are entering this space, particularly if you haven't had a relationship with them in the healthcare space, and ask, what is in it for me? And you must wonder, what is in it for me? And
Yeah.
once you have those things transparent and on the table, I think that's where, honesty and transparency starts. And that's where we can start to grow. This is not a comfortable space, particularly when you're starting to talk about what we do in iCCaRE. Cancer is a big word.
Yes.
Cancer is
Yes.
we have many different opportunities.
We think of death all the time with
Yes,
cancer.
it's a big C,
Yes,
right?
yes.
And so while we've made significant progress, there are more than 18 million cancer survivors. And even while that's a great statistic, those are 18 million people that's wondering if the cancer is going to come back,
Ever come back.
right? So it's not a process where it's one and done. And we must understand kind of the entire ecosystem of the patient journey, the care journey, the treatment journey, and recognize, like you said, that it's difference that exists in how we're showing up, difference in time, and that there's no one and done, there's no one size fit all. And that's what I love about opportunities like this, where we get to work together and focus our energies on a group that really is taking the hit, that has an increased burden. The science is what it is. We can get to the root causes and try to figure out why so that we move forward. But we also need to work with what we have and what we know. And so while we're trying to work on how to identify things earlier, how to create models in science so that we can recognize disease earlier, understand PSAs differently, change screening. But once we show up in community, we have to see our brothers and our fathers and our uncles and and we've got to understand that this is a time for us to really work on how to move this needle in a direction that's more positive. We cannot continue to not treat and better understand the survivor point of view, the pre-survivor point of view, what's causing patients to be resistant about entering medicine and medical care in particular, understanding the lifestyle of the Black man in particular, and what's best for them, because it's all important. So we may be trying to get to a place where we want to educate about prostate cancer, screen for prostate cancer, treat early prostate cancer, help you to survive prostate cancer, help you to live with prostate cancer, help to understand that once you have a diagnosis, your whole family is experiencing prostate cancer with you. And so we may take all of that into consideration. But the one wonderful thing about iCCaRE and behind the scenes, there are many different people working behind the scenes to tackle different parts of that journey. So there may be physicians and scientists like me. There may be scientists who are working on models who are helping to get, the science together. There are people who are working on survivorship, who are going out on weekends and just sitting down and saying, hey, brother, tell me, brother, like, what's going on? How did your wife receive this information? How do you feel as a man? What were your challenges? And then we're creating technology in other spaces, and God knows I am not a techie, but under the same iCCaRE umbrella, we're creating tools, right, that will help younger men and older men, and we're recognizing the generational differences of how to move forward on this marathon for the prostate cancer, in the prostate cancer ecosystem, on the cancer journey.
I think about, because you're touching upon the culture and teamwork and how there is no I in teams and teams. I think of a commercial, or I think it was one of these Lord commercials, and you see a person, maybe in a wheelchair or something, but then it fades out and you see, the EMT, and then you see doctors, and then you see a team of people behind them, supporting them. And again, when people interview, I always think of keywords that pop in my mind. And the keyword that came to me when you're talking about the importance of longevity. Even though we may be diagnosed with prostate cancer, with a disease, it does not mean that we can't move forward through it together to have longevity. And hopefully maybe even limit the fear of every time I wake up, oh my gosh, or every time I go to a doctor, am I going to get the diagnosis again? Which leads me to the question of longevity and years down the road. What do you want your legacy and your work to be about?
This is it. I'm going to back up just a little bit to tell you I said, Dr. Detna and the timing of how I came to this space. But what's interesting about that point is that my father had just passed. And I remember sitting at his, homegoing service and hearing about all the stuff I didn't know about. People were walking up to me and telling me about all the stuff that my dad did. He was just my father to me. I knew his business aspect. But I thought, what are people going to say about me and just how wonderful it is that I was able to benefit from all of that he did for the community. And at the end, it wasn't how much money he had or that his daughter was a doctor or whatever. It was about all the things that he poured into the community. And I thought, as much as I thought that I was doing in medicine, where can I actually be more like my dad in this space? And how can I have a legacy? And this time is so explosive as we think about AI, as we think about the short shelf life of the information that we have. Like, this is a very exciting time in medicine.
And how instant it is, too, at times.
Instant, right? And so with that challenge came a certain amount of uncomfortability, discomfort. And I knew then that that's kind of where I needed to be and when I needed to be in this space. And so took on this challenge to be part of that legacy. So that, you know, my daughter Joy, my son Joshua, who've always known me to be a physician, community actor, but that they could actually see me being uncomfortable at every season of my life for the benefit of a community. And so never resting on laurels, never being so comfortable as any physician, scientist, you know, community speaker, TED Talk, or whatever, where I wasn't wanting to push myself. And I wanted to push myself with a team of people like you, who actually were just as in it as I was in this journey. And so a legacy, I always say that I want my tombstone to say she was a mom, but if it had to say something else, I would like it to say she was a mom who cared about her community. And that's what I would like to be. If it says I helped to cure cancer, heal cancer, increase, you know, the length of life for anyone, that's a bonus, because it's about really the ministry of medicine for me and what I can do. And a friend of mine said it best, you know, if we do this right, we will die empty, right? And I don't want to make this a morbid conversation. But I want my legacy to be that I've just poured it all. I left it all. I left it all out there.
Okay, because we can't take it with us.
We can't take it with us.
We can't let it out there.
Exactly.
Let it out
so as long as I have it to give, and I can't do everything, right? So this is such a wonderful space that we have in the cancer care journey, because we are benefited from all of the things that we did wrong. We've learned those lessons. We've also realized that the physician's not the smartest ones in the room anymore, right? That the patient's voice is important, that advocates are influencers. We are living where I didn't even know if I used the word influencer 20 years ago in medicine. But we're living in a space where we recognize that you have more power as an advocate, as an influencer with more people than I possibly do in my circle. So why not work together to do this? And so one and one makes 20.
Exactly.
Plus you're my cousin, so
Okay, I'm going to see you at the family reunion later next
There we
year.
go. Exactly.
and so we leave it with that. Y'all invited to the family reunion too, so y'all come on as well. You know, we can somewhere down there.
But who's making the potatoes?
There you go. See, there, here we go. Look, let's get in the menu together. Again, we appreciate you for joining with us. What a great time, cousin. Yes. And you said something that was so important. You know, I like to leave with a good word, you know, as we say.
Okay, preach now.
Testing produces perseverance and character. Now, I know that may be the NIV version, you know, but I'm just saying that you talk about that and how we have to go through that uncomfortable time to truly see our character and truly see what God's called us to do, and then our goal, you know, our goal at the end. So let that encourage you, let that uplift you, and we'll see you again soon. Thank you for joining us. Have a great day.